But madam has to be there, no?
Madam is there.
No, but I think she's stuck. She's not. Yeah.
Hello.
Yes, yes. Good evening,
Yes.
Madam. We are starting the session. Welcome,
Okay.
everybody. Today is the 32nd Vasudhaiva Kutumbakam webinar series organized by the Sustainability Standards Board on the topic of holistic health, the key to sustainable happiness. We welcome Dr. Alpa Dalal, who is the HOD of Pulmonology, Jupiter Hospital, as the speaker for this event. Also, we have with us our chairman, CMA Dr. Ashish Thatte. Welcome, sir. Before we start this session, we start with our institute's anthem.
ततो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्युर्मामृतं गमय असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्युर्मामृतं गमय असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्युर्मामृतं गमय.
So just a short profile of Dr. Alpa Dalal. Madam is the HOD of Pulmonology in Jupiter Hospital. She is also the nodal chairman of TB Center at CRE TB Hospital. She is national expert for difficult to treat drug-resistant TB cases, co-founder of Health Bank, an organization she started with two sisters to create awareness and teach people to invest in their wellness. She is also a yoga and holistic health expert. She did her master's in Kriya Yoga in 2014, diploma in yoga teachers training in 2009, has learned pranic healing and Ariatic yoga in 2022, started yoga and meditation program at Jupiter Hospital in 2012. She started sound healing with Tibetan bowls for holistic rehab of patients at Jupiter from 2017. She has conducted and published research paper on effect on Kriya Yoga on neurocardiac physiology in collaboration with Chest Research Foundation, conducted research on impact breathing, exercises, medication, and sound therapy on COPD patients. She also presented a paper on in Barcelona in 2019. And before we have the session of our Madam Alpa Dalal, I will request our chairman, CMA Dr. Ashish P. Thatte sir, to give his short message for today's event. Over to you, sir.
Thank you so much, Rai Saab. Good afternoon to all. Welcome, Dr. Alpa Dalal, madam. Um, Sustainability Standard Board is working, very hard for bringing various aspects of the life to all our members. And today is also one of the day where, in a very different approach in our thinking, which we are bringing for the profession. So maybe there are 101 attendees today, but I know that these are from various different parts of the country. Maybe few of them might have joined abroad also. And as the time progresses, you will find that we increase the number of attendees also. Every second and fourth Friday of the month, we have our series of Vasudhaiva Kutumbakam and many different programs which are arranged in this. Besides that, Sustainability Standard Board has of late issued the guidance note on the ISS 1 and ISS 2. So requesting all the members, all the attendees today to kindly go through the Institute website and respond back on those guidance note, which are at the draft stage currently. So I think I'll not stand between all the attendees and the holistic health today. I would love to be the part of this for the throughout session, but since madam is from the Thane itself, I can get her sessions directly, meeting her in person at the Jupiter Hospital any point in time. So this gives opportunity for Thane-based Jupiter Hospital to reach across the country also. In fact, many places in the globe also. So thank you so much, madam, for accepting our invitation and requesting you to please kindly take over. Back to you, Roy Saab. Yeah.
Yes, sir. Madam, now we request you formally to start your session. Everybody is waiting for that.
Okay. So namaste and thank you so much. It's a privilege to be part of this event. And I've heard about your organization and the wonderful work that is being done. Just the other day, I was talking with Mr. Ranjit Krishnan, and he gave me the kind of fundamentals of your organization. It's about sustainable growth. That I mean, one should progress and one should not compromise the development, but at the same time, not disregarding the environment and progressing at the cost of, not at the cost of your own environment and all on well-being. So that is very much in line with today's theme of the talk that I'm going to give. And see, the first thing that we start with, what is happiness? Okay. Since the topic of today is sustainable happiness and how holistic health leads to sustainable happiness. So this is just that, how do we define happiness? Okay, can we really define it? Can we really, give some structure to it, or it's just that the feeling or emotion that we experience? And it is such a subjective thing. When you read about the happiness, it talks of, short-term happiness, which we get because of some experience or experience of any of the five senses, or we talk of more lasting happiness that we have because of the life that we live, our life experiences, the goals that we have achieved, and the work that we have done. Okay, so the short-term happiness would be more in terms of a pleasure, while a long-term happiness is a more holistic view, and that's exactly the basis of today's talk. And I would like to little bit share my own journey into this holistic happiness. So I have been, practicing in city of Thane for past 30 years. I've just completed 3 decades of my practice. And like we all know, any busy professional, once you start working and once the success come, you start getting busier and busier. And the same thing happened with me. Some 10 years into my practice, I was extremely busy and become very well known. So, number of patients, number of commitments, academics, all that was going on. So that time, in 2008, I myself suffered one health condition. I had been diagnosed with IBS. It is called irritable bowel syndrome. And everybody is aware that this irritable bowel syndrome is all because of stress and anxiety. And I used to have this in my medical days, but well, that time in my post-graduation days and in my undergraduate days, so that time you don't have much of responsibility otherwise. And this at the peak of my career, I suffered it. And then like any other, patient, I had to undergo all the various tests and investigation. And then I realized for the first time what it is to be on the other side. And also, I couldn't really get all my answers from my modern medical science, because once I was diagnosed with IBS, and they just said, okay, it's all stress induced, and you just have to take care of your stress. So I said, oh, yes, I understood. And I know I've read about it, that it is stress induced, but can somebody tell me how to take care of my stress? No. So I don't think I got a holistic answer from my own medical science. That was when somebody suggested to me to go towards yoga. And I started doing yoga. It was, less from my liking, more out of desperation to get relief from my symptoms. And within 1 month of doing yoga, I really started getting very good relief in my symptoms. My energy level started improving. And first time I actually learned about breathing. Okay, how to breathe, pranayam, how to regulate your breath, how the breath has impact on the mind and emotions and all. And first time a realization came that, well, I'm a pulmonologist, a very successful pulmonologist a doctor of lungs, and I have done very well in my studies. I was topper in my in university. I knew my subject very well. I knew the anatomy and physiology very well. I would advise my patients, okay, you do this yoga, you do these exercises, breathing exercise, etc., etc., etc. But I myself got so busy that I never had time to look into how my own lungs work, how I can improve my own breathing. And then I realized that knowing a subject theoretically is one thing, and practically experiencing for yourself is completely a different thing. And then when I started experiencing the benefits of pranayama, the benefits of breathing exercises, then I knew that now I can say that I know my subject, my field, my area, pulmonology, the lungs, even with my experience, not just as theory. Okay. And I got so interested into the subject, and then I decided that I want to do teachers training in this. Then I joined a diploma course in 2008 in the very prestigious Institute of Thane, Kantari Mitra Mandal. And then I learned about it. After learning, I started teaching, and I started teaching my patients also. And I saw how I could really make this synthesis of modern medical science with the holistic science of yoga. Okay. Then in 2011, I met my masters, Dr. Premji Nirmal and Bharti Nirmalji. And from them, I learned Kriya Yoga. I was initiated into Kriya Yoga. So I went into meditation. Then we did research on this subject of Kriya Yoga. We published a paper. And so many different findings we got from this paper, that how doing this breathing practices, doing yoga and doing meditation, it actually brings about neurophysiological changes in your brain. We saw in our research that one particular area in brain, which is called area 23, with regular 6 weeks practice of meditation, that area becomes active. Now, which is this area? This is the area which becomes active when one is in very happy mood. One is in very positive mood. One is very alert and able to process information from different parts of the brain. This area becomes active when a person is coming out of coma or a person is coming out of anesthesia. So with the regular practice of meditation and Kriya Yoga, it's not only that it just gives you a feel-good factor, but is actually making neurophysiological changes in your body, in your brain. So that was really, eye-opening for us. And then I, started incorporating all this teaching into my own medical practice. And I started seeing that patients who were introduced with the medical science, along with that, all these holistic practices of yoga, meditation, Kriya Yoga, they started not only improving much faster in their health, but what happened was that their mindset and attitude started changing. And that is the key. It's very difficult to change our own attitudes, which we have been carrying it for years together. Okay, in Marathi say, स्वभाव कभी बदलत नहीं. Okay, that is what you say. स्वभाव को change करना बहुत मुश्किल है. So what I started realizing that we get a certain set of patients and they would have certain similar kind of attitudes. And same patients who, same kind of health condition, but patients who learn holistic practices and they practice regularly, even though their scans or their blood tests or their other tests look similar, but patients who started doing this holistic practices, they would improve much faster. They would stabilize much more than the people who don't do it. So this kind of become a part of regular, practices in the hospital. And I would say Jupiter Hospital administration was so supportive. And we used to have 1,000 square feet area in the hospital where we would conduct meditation classes. We also started using sound therapy and sound healing with the Tibetan bowls. and hospital employed a sound therapist for the patient. We started using this for our OPD patient, indoor patients. During COVID time, we used these modalities and with extremely positive results. Okay, so this is how incorporation of all different things started to take shape. And then in 2022, I learned pranic healing. That was another very scientific approach towards healing, and which uses the energy body, our own energy body, to bring about changes and balance and harmony in our system. Okay, and we started using that too also in patient. So this is how my own journey started. This is how I experienced it myself firsthand. I learned it and I started teaching, and it became part of my mainstream medical practice. Okay, and this is how I am here today to talk on this subject, being a allopathic medical practitioner, being a subject specialist. This is how my journey started, and I would say after that, my own understanding about health, my own understanding about happiness became more complete. Okay, and I started working on this subject. Okay, so this is what is the background, and I would say that all of us as professionals, we do excellent in our field. We do very, we're very professional in our field. But when it comes to our own life or when it comes to our own health, we lack the necessity, time, and attention that we need to give it to it. Okay, and that is where the journey has to begin. That is where the inquiry has to begin. Okay. So what I realized that when we talk of holistic health or holistic happiness, there are 4 domains in our life. Okay, so whatever experiences, good or bad, challenges or achievement that we have is in these 4 domains. One is health. All of you would agree that health, and after certain age, that becomes the main, main issue. Second is wealth and finances, which you all know much more than me. Okay. Third is your relationship. Okay. And the fourth is your career and your success in your career. Okay. Education, career, and success in your career. So if you think of all your life events, the challenges, the difficulties, the traumas, or the achievements and joys, all of this will revolve around these 4 areas of life. Okay. Would you agree with me? Okay. Now, so when first time I had met my master, from whom I learned Kriya Yoga, he made me do a small exercise to find out how balanced my life is. Okay, this is called 7 dimensions of life. We can call it 7 dimensions of health, or you could call it 7 dimensions of happiness, whatever you want. Okay, so nowadays we also know that health has been defined in a more broader aspect. It's now physical, mental, emotional, social, and spiritual health. Okay, so we added 2 more dimensions to it, the time dimension and financial dimension. So when you take stock of all these different aspects of your life, then you know how your life is progressing. Is it really balanced, or is it more focused on one particular area? How is it going? And it tells you whether you are leading a balanced life or not. Okay. So now a small exercise that you could do. Second thing, you must be aware of the resources. Now, I did not tell you because you are in this field, and in your field, you do resource analysis so well. So what are the resources that we have? How can we wisely invest these resources? How do we understand the expenses? How we can seal up the expenses? And then, as you grow your resources, then you start to enjoy the benefits of the resources. Okay. So when we are talking of these resources and the businesses and the venture that we talk about, but I would like to talk about the most important venture in your life. and that is you yourself, none other than you yourself. And that's the most important venture of your life. And unfortunately, we get so busy in the outer world, we get so busy and carried away, investing all our time, talent, and energy into the outer world, that the inner world or your own self is kind of taken for granted. And you feel that, oh, it will be taken care of on its own. But today we are going to talk about this venture, you yourself. Okay. And what are the resources you have? So, 4 resources that you have. One is time, second is money, third is your energy, and fourth is your talent. Okay. And all these resources are not unlimited, right? The resources have their own limitations. Okay. Money, yes, you of course make it grow, you work on it, but still it would have some limitation. Second is time. Time, you cannot buy it, we all know. It has its own limitation. But how do we, you know, increase the time that we have is by improving our effectiveness. By improving our effectiveness in the same time that we have, we can do much more. And that's how we grow in the resource of time. The fourth is talent and skill, which takes some time to develop. But yes, you can grow in your talents and become more effective. And the fourth thing is the energy. Okay? And that is something which is completely dependent on yourself. Okay. Money, if you don't have, you can borrow. Okay. You can take from somebody, somebody will provide for you. But energy is something which you cannot borrow from anybody. It's your own, and you have to understand the equation of energy perfectly well. Okay. So, what is this equation? One, you should know how do you earn the energy? From where do you get the energy? The second aspect is where can you save the energy? That means you must understand that where do you spend your energy? Okay. Where can you prevent the expenditure of the energy? Third is that how do you invest this energy? In what activities you are doing, in your, what way you can invest your energy to invest into your long-term happiness. And the fourth is that once you do other 3 things wisely, that is earn, save, and invest rightly, you are going to enjoy the benefits of the energy. And this enjoyment in terms of fulfillment, happiness, perfect health, balanced life, and all this and much more. So this is what we are going to understand today. Okay. And before we understand that, okay, we will do a small exercise called 7 dimensions of happiness to know and to see how balanced our life is. Okay. So should we do the exercise? So I want everybody to take a small piece of paper and pen, and you will be marking yourself. So as I share with you the different dimensions of life, you will be marking yourself and giving yourself marks. Okay. You may be doing that for your students, but today you're going to do it for yourself. And be very, very honest. So not to show it to anybody, but just to introspect and reflect on your life. Okay. Can I just share my PPT?
Yes, ma'am, you can.
Yeah. Give me a minute, huh?
Yes, yes.
Yeah, so PPT will be coming. We can start with the exercises, okay? So first we'll start with the physical dimension, and you are supposed to mark yourself out of 100, okay? Now, what are the aspects you consider in physical dimension? One is your diet. How careful you are about your diet, all the aspect, the nutrition aspect, the calories, and whatever you know about diet. How, and timing also important, whether you are able to have your food in time. Then the second aspect is about sleep. Okay. Are you able to sleep at least at a stretch for 7 hours in a day? And the night sleep, it is said that between 12 or between 10 in the night and between sunrise time, 7 a.m. in the morning, if you can catch up 7 hours of sleep, that's the best kind of sleep schedule or sleep hygiene you have. So that's about sleep. How regular are you with your exercise? Okay. And what is your overall physical health and fitness level? Okay. So based on these 4 aspects, diet and nutrition, your sleep, at least 7 hours of good sleep, sound sleep, your exercise schedule, and overall physical fitness. Okay. So you can mark yourself out of 100 and be very realistic and honest as to what is the situation now. There are some of my students, when I do this exercise, say, oh, we have planned to start exercises from next week. You know, you plan a healthy lifestyle from next week or after next month. So that is not your reality today. Okay, what is your reality today? You mark according to that. So that is your physical dimension. Just a minute, I'll see if I can open the there.
Here ka
Mm.
PPT.
Yeah.
This thing.
Yeah. Can you see my PPT?
No, ma'am, you have to share it. Share
Okay.
option is there in the top right. If you see, share option is there.
Okay.
Top right, on the
Yeah,
left of
yeah.
that leave button.
You
Yes,
can see
it
now?
is coming. Yeah, it is
It's
coming.
coming now. It's
Okay.
coming.
Okay. So this is my hospital, Jupiter Hospital, and this is my department. In our department, we have not only pulmonologists, but we have sound therapists, yoga therapists, our nurse, and our physiotherapy team. And this is our patients who do the meditation. I mean, you are part of the yoga and meditation program in the hospital. So this is what I have learned from our master, Guruji Prem Nirmal, the 7 dimensions of life. When I met him first, and when I learned Kriya Yoga from him, he made me do this exercise, and that was an eye opener. So we discussed physical, mental, emotional, spiritual, social, financial, and time dimension. Okay. So how do we go about it? That's what is this session all about. Okay. So I told you about the physical dimension. So diet, exercise, fitness, sleep, and overall health. Okay. So you mark yourself. If you say 0 to 30, then it's poor. And you really need to look into this. 40 to 60 is average. Chalta hai. 70 to 90 is really good. And beyond 70 is like you are super. Excellent. Then coming to the mental dimension. So mental dimension is about your concentration and focus. Nowadays, you see there's so many distracting activities are available. So many, social media activities are available. So you see, people are really finding it difficult to concentrate on focus on one particular thing. When in conversation, their attention span becomes so small. And many times when we are multitasking, we experience this, being so pulled in different directions, and concentration and focus gets affected. And peace of mind. You have to do all the work and you have to carry on all the responsibility, but are you getting hassled with this, or you are able to do it with peace of mind? Clarity and decision making. We do get a lot of information and we have a lot of knowledge, but when it comes to decision making, it requires your, clarity of mind. So are you having that? An inclination to drop the old things and learn new skills. Okay? Are you able to do all these things? Then you mark yourself in mental dimension. Again, poor, average, good, or excellent. Going to the next dimension. So this is what we experience, right? We talk of mindfulness, that is being absolutely relaxed. But on the contrary, we are always, mind is full of multiple thoughts and multiple activities. So I think the idea is one should move from the mindfulness to mindfulness. Then the third dimension is emotional dimension. Okay. So this is all about experiencing emotion, and that happens mostly in close relationship, okay? Be it at home, mostly with the spouse, okay, with children, close teams, when you're, team members. So a lot of ego hassles and a lot of, attitudinal problems arise in the close relations, emotional, more to do with personal emotion relations. So are you able to control your emotions? Are you able to control your anger, your judgment, your irritation, coping with stress? This is a emotional dimension. Again, mark yourself out of 100. Be realistic and as to what is the current state. Then comes the fourth dimension. Okay, this is very much a social organization and the kind of work is being done. So you are very well aware of this aspect, but it also involves your relationship with colleagues, with your seniors. It's also about your communication skills. Are you able to communicate clearly what your thoughts are? Are you able to influence the people, the masses? How aware you are giving back to the planet. Vasudhaiva Kutumbakam is how aware you are to give back to the planet, to create that environment, to work towards it, not just in thoughts, but actually working towards it and giving back to society, all your charity work or all your philanthropic work. So that is very much part of our well-being, to give back to society. Then comes the financial dimension. Earn, save, invest, and enjoy. I need not tell you about it. I'm sure I think all of you would score more than 90. But sometimes it happens, like in my case, I was a very good doctor, but I didn't have time to look at my own health till I entered into this field in 2008. Same thing can happen with you also working in finances, that you are so focused, busy helping other people that you may not have time for yourself. Or many times, these three aspects, earning, saving, and investing, is good, but you don't have time to enjoy your own money. Then also you are not, rich in the financial dimension. Then the time dimension. So do you know your priority? What is to be done? Or do you always get carried away by others people's expectation on your time? Okay, punctuality. Finding time for self. I think this is what all the profession always, this is what is the problem, that you do everything to please others, for your organization, for your family, take care of your responsibility, take all your roles very seriously. And in the end, which business suffers the most is you yourself. Okay. You don't have time for self. How good are you at time management? Again, mark yourself. And last is the spiritual dimension. Okay. This we usually postpone till the end, after I retire, after all my responsibilities are over. Then I will sit in meditation, but it never happened that way. It has to be part of your life from very early days. Like in my hospital, I've started the meditation classes for our students and paramedical staff. And I can see how they are shaping up so differently. And I wish I was introduced to this kind of meditation in my learning days, and I would have, begun my career in a very different way. The spiritual dimension is about meditation, introspection, being grateful to whatever you have in life, being grateful to the people in your life, and just being happy without any reason. Okay. So this is what I mean. Your happiness should not depend on external factors. Your happiness should not depend on others' behavior. Your happiness should be just because you are in that state of happiness. Okay. So again, mark yourself. So this is what I learned from my masters, and gratitude to my masters. Okay. So I hope you have enjoyed the exercise and have some introspection and insight into it. Okay. So now, when you're talking of this holistic sustainable happiness, then you must see that for holistic sustainable happiness, the areas, different 7 dimensions of your life should be well balanced. Okay. I'm not saying that it would be perfect, but at least it should be well balanced. Now, when I did this exercise and I realized that, my financial dimension was very strong that time because I was already doing well in my practice. My mental dimension was strong because, when you're professionally very active, it involves being very good at academics, learning new skills, and we all professionals are good in that dimension, right? So financial dimension was good. Mental dimension was very good. Social dimension was also very good because, as part of our profession, socially you are very active. So social dimension was very good. What other dimension? I didn't have any time to do my physical exercises. Emotionally, I didn't have much time to spend with my family. Didn't have enough time to go and meet my friends. So emotional dimension was definitely compromised. स्पिरिचुअल डायमेंशन तो बहुत दूर की बात है, बेसिक रेस्ट भी नहीं मिलता था, तो स्पिरिचुअलिटी मेडिटेशन तो आउट ऑफ क्वेश्चन. एंड टाइम, बिग टाइम, ऑलवेज running around here and there, torn apart with different roles and responsibility. So my 3 dimension, that is mental, social, and financial dimension, were strong and big, and other dimensions. So as I told you that we have limited resources of time, money, energy, and talent. So one dimension you'd end up investing too much of all these, then other dimensions are going to shrink. And that is what creates the imbalance in life. And that is what I realized that, I realized it late only when I had to really stop work for 15 days. And that's when I realized, oh, this is what is the imbalance in my life. Okay. So then what do you do? Once you realize, first of all, you have to do, the mapping, right? And you do the mapping, then you understand that, okay, this is my strong dimension because I have been investing too much into it. Then can I now take out some of my time and energy from this dimension, which is already strong, and invest into the dimension which is not so strong? And when I started doing that, I started giving every day 1.5 hour of my time for my exercises, meditation, and for things that I wanted to do. I started spending more time with my family. I started spending more time with my friends. And then I realized that that balance was created. And then slowly, definitely the happiness quotient is much more, even though, you make lesser money, that really doesn't happen. But if you make lesser money, doesn't matter. Because after some years of your professional life, you are met with all the requirements and the needs, and whatever extra you are making is not going to add to your happiness in that proportion. Okay. But if you create imbalance in other areas of life, just for your career and finances, then definitely it's going to invite unhappiness in your life. The sooner we realize that, the sooner we should start taking steps to correct it. Okay. So this is what I realized. And then it's like I tell my friends who have still not realized this, that like you are going to the gym and then you decide only I want to exercise my right hand, my right upper limb. Okay. other three limbs I ignore and I just exercise. What happened? That limb becomes hypertrophy in another part of compared to the other part of it. How ugly it will look. Okay. So this is exactly the same thing we do in our life. We go on pumping our time and energy into certain areas of life where you are comfortable, and then at the cost of compromising the other areas of your life. Okay. And then the life gives us some, ugly surprises. Okay. So now we will go on to how do we correct this. But does anybody want to share the experience of the exercise that we did and what you realized?
So, right up, do we have any system where people can respond back with the messages?
Yes, sir. They are giving in chat line, but they cannot speak.
That's the problem, because that's our method by which we do this program. So you will get some chats from people, they may not be able to speak.
Okay. So do we have some close group, or here we are only three of us?
So you can interact only with three of us, that is between three of us.
Okay.
But others, you can chat. You can check the chat. There you will find, besides their numbers, that is their membership numbers, they might put some questions also.
Okay.
One question has come. One question has come. Doctor, a question: can a person improve their LVEF, and by how much?
So what can they improve?
LBEF, I cannot understand what is the LBEF.
So can they give a full form, and then I would understand.
I think.
Would you, either of you, would you like to share the exercise and so the others can just understand?
Yes, ma'am.
I do good on physical. I am okay with financial, but rest all are, I mean, very difficult for, spiritual is still far away. Time management is still okay. I mean, not that good. I mean, only these points where I have, some positives. Otherwise, as what you stated, rest all end up with the red only. And that too only, average with this, and that too financial means, it's all state of a mind. If you compare it with the richest person in the city, you are still poor. If you compare with the poorest person in the city, you become very rich. So it's like that.
Yeah. I mean, I think your most important thing is not comparison our own. Maybe whatever resources we have, whether we have time to enjoy. And that was the biggest thing which I realized, that, I'm good at earning, I'm good at saving, because I don't have time only to spend. So I'm good at saving and then investing, and, but I don't get time to enjoy my own money. So that is, that is the issue with many of us. Anyway, the thing is that probably different people will have, different strong points and different weak points. The idea is to realize your weak points and then invest your time into it. Okay, that is the whole point. So now, let's come to the aspect of energy. Okay, when he said money, energy is money for us. Money can be borrowed for the time being if you don't have, but energy cannot be borrowed. So all the time we have to be aware and learn the ways of how we can sustain our high energy level. And that is the crucial thing for sustainable happiness. See, anything you do in life, it may be work, education, career, making money, taking care of your responsibility, or even, just enjoying life, or, progressing in spirituality, whatever you want to do, you need to have energy. Unless you have energy, you will not be able to do any of this. Okay? And that's why it's very important that you understand the energy equation. So first thing, where do you get the energy from? Okay, the maximum amount of energy that you live for your body, for your for doing various activities that you do, where does it come from? So most of the time people say from food, from water, but food we have 3 times in a day, even though a lot of our attention is occupied with food 3 or 4 times in a day. Water maybe 8 to 10 times in a day, but main source of energy is your breath. Okay, the main energy that comes is through oxygen, and that oxygen takes care of most of your metabolic needs. And so the key thing when you want to grow in energy is your breath. Okay. In a day, we breathe about 21,600 times. Okay, 21,600 times in a day we breathe. We take about 10,000 liters of air inside and we expel 10,000 liters of air inside, and that gives us about 500 ml of oxygen, which we use for our daily activity, for our metabolism. Okay, so the best way to grow rich in energy is to learn how to breathe right. Okay, and that is what we are going to teach. So some practical aspects is very important. Something that you learn and practice daily is going to help you in improving your energy levels. Okay, so we are going to learn this. It's called blissful breathing. Okay, blissful breathing is what you do, and there are 3 components of it. I'm going to show you how to do it, and all of us should do practice right now. Okay, first of all, your posture has to be correct. Wherever you're sitting on the chair, you align your head, trunk, and your head, neck, and trunk, which should be in one line, straight line. Okay. Then your left hand should be put on the navel, and the right hand should be put on the top of the navel. Okay. And there are 3 components of this blissful breathing. The first component is when you are inhaling, your tummy should go out. The second, the inhaling, tummy should go out. When you are exhaling, tummy should go in. When you are inhaling, you inhale for 3 counts, 1, 2, 3. When you are exhaling, you exhale for 2 counts. And when you exhale, you are supposed to push it from above with your hand and pull your navel inside. Okay. 3 things. Inhalation, tummy goes out. Exhalation, tummy goes in. Inhalation for 3 counts. Exhalation for 2 counts. And when you are exhaling, press from above and pull the navel from within. Okay. So let's practice all 3 together. Practice the breath with all 3 components together. And after that, you'll just sit quietly for a minute, keeping your hands like this, resting on the lap, and see how you're experiencing. Is your state of mind feeling different? Are you feeling calmer? Are you feeling peaceful? Just experience. Okay. So left hand on the navel, right hand on top of the left hand. Correct your posture. Head, neck, and trunk in one line. Now inhale, exhale. Inhalation, tummy out. Exhalation, tummy in. Inhalation for 3 count, 1, 2, 3. Exhalation for 2 count, 1, 2. And while exhaling, press from above and pull from within. Let's all do together. I'll do the counting. Keep your eyes open as you're breathing. Get ready, start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Now just keep your hands like this on the lap. Close your eyes. Slowly open your eyes. You can put it in the chat box. Did you feel any different by doing this exercise? There was
It
some
was
sense
much better. It was good.
better. Such a simple thing. Such a simple thing. Just focus on your breathing. Just take care of the rhythm. And with full awareness, take the breath. Okay. Such a simple thing can increase your energy level so tremendously. And this is very much doable, right? Night, when you go to sleep, before crashing on the bed, just do this for 22 minutes, 24 breaths, 12 minutes in 12 breaths in 1 minute. Morning when you get up, no, just starting your day with a hassle. Don't. Okay, nothing will go wrong in 2 minutes. Do this breathing for 2 minutes and then slowly start your day. Okay. Even if you start doing this 2 times in a day, then day to night when you go to sleep, when you wake up and start your day, you will start feeling a huge difference in the state of your mind and the way you start your work. Okay. And in between, you can do anytime you feel stress, you feel fatigue, you feel low in energy, just do this breathing exercises and you will see how the state of mind changes. So this is very important. One more breathing exercise which I'm going to teach you, it is called square breathing. Okay. Now this is, I'll give you the explanation how it works on your mental state. Okay. So all of us will learn the square breathing. What is a square? Square is equal on all sides. Okay. So breathing actually has 4 parts. One is inhalation. Then there's a small gap and then comes the exhalation. After exhalation, there is a small gap and then starts the next inhalation. Okay. So these 4 components we are going to do equally. Okay. I will show you one and then we'll do together. Okay. When you inhale, say 5 count. 1, 2, 3, 4, 5. Then hold your breath for 5 counts. 1, 2, 3, 4, 5. Then exhale. 1, 2, 3, 4, 5. Hold your breath. 1, 2, 3, 4, 5. Okay. Simple. Let's do it together. Okay. I will do the counting. So 2 are dynamic. That is inhalation is dynamic. Exhalation is dynamic. And 2 are static. When you are holding your breath in between, you are not doing any activity. Okay. So let's start. First take one breath and relax. Inhale. 1, 2, 3, 4, 5. Hold in. 1, 2, 3, 4, 5. Exhale. 2, 3, 4, 5. Hold out. 1, 2, 3, 4, 5. Okay. One more time we'll do it. Inhale. 1, 2, 3, 4, 5. Hold in. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5. Hold out 1, 2, 3, 4, 5. Okay. Now, how this exercise helps you in your relationship? Okay. Now, most of the time, what happens that when you get some input from the other person, you quickly judge, analyze, and then react. Okay. And then as we react and give out a response or reaction, the other person will equally react, and it just goes on like thing, bouncing. Okay. Now, how this exercise is helpful, when you get an input from somewhere, it's like inhaling. Okay, you're getting an input. Just don't respond or react to it. Hold that information inside. Process it. Why is it being told? Why is it like this? What does it mean? And then exhalation is like a response. Rather than reaction, it is a response. And then holding in exhalation is you're allowing that other person to absorb what you have told, allowing that person to process it and wait for that person's response. Okay. I mean, it's an excellent way of improving your relationship and being responsive rather than reactive. Okay. So these two exercises, I think if you practice regularly, will definitely make difference in your energy levels, in your, peace of mind, calmness of mind. And there are a lot of things here, but this is just a small thing which I wanted to teach you on this today's session. So this is about earning the energy. Okay. Now, second aspect is where do you spend the energy and how do you save it? So now it is said the maximum amount of energy you earn through breathing and maximum energy you drain through your thoughts and emotions. Okay. It's like, so in a day, maybe you are talking 10% of what you are thinking, or not even that much. So whatever you are talking, 10 times more is going on, being processed in your mind. All the time the chattering is going on, chattering is going on. It is said that 90% of the thoughts that you are getting are non-productive or counterproductive. Okay. There are very few functional thoughts that you get and that you need. If by some means you learn how to be in control of your mind, and that will be the best way to save your energy. So this is precisely what we learn in meditation. When you are meditating, you learn to look at your own emotions and your thoughts. Okay, and then when you are able to control it, it saves a lot of your energy. So with the breathing exercise, you have learned how to earn more energy. With the meditation and being calming down, you learn how to save the drainage of energy. And now, so you have energy surplus available. Where do you invest this energy? Okay, now you should invest this energy in your own self, in your physical exercise, in your enjoyment, in your well-being. And then when you invest this energy into yourself, you start to enjoy the benefits of the energy for a long, long time. Okay. So people who've been regularly exercising or every day giving 1 hour to their exercise and mental, emotional well-being, they live longer, they live happier, and they have less health-related issues. That is what it is. Okay. So this is the simple equation which all of us need to understand and practice in our life. Okay. So that is what is all about I had to say. And certain thing as a doctor, like many people have questioned that what is the right thing to do about the physical exercise? Okay, because some people are into walking, some people do swimming, some people do, just a yoga. So what is the right way of doing it? Now it is very important to understand that when you are doing exercises, it should be a combination of things. The exercise is meant to increase your stamina. It should increase your endurance level. It should increase your aerobic capacity. So that is running, cycling, swimming, or Suppose you are doing Surya Namaskar in yoga, doing it at fast pace, all that will improve your aerobic capacity. It will increase your stamina and endurance. Okay. The second is your breathing exercise. So breathing exercise will help you to open up your lungs more. It will help you to increase your oxygen level. It will help you to improve your lung capacity. The third important aspect is the strength training. And that is something which is usually overlooked because not everybody goes to the gym and does the weight training. But this is extremely important. It is said that after the age of 30 years, you start to lose your muscles regularly. And after the age of 50 years, this loss is pretty rapid. So almost 1% per year, you start to lose your muscle mass. And after the age of 70, this is even faster, 1.5 to 2% you start losing your muscle mass. And the only way to counter this is by doing strength training. So in different ways, you can do strength training. You can go to the gym and learn. You can go to any physiotherapist and learn how much weight to use it, or the bands can be used, and or you call your trainer home. But at least 3 days in a week, the strength training exercises has to be done. Okay. I used to do yoga and meditation for many years, but almost 5, 6 years back, I realized that was not helping me to strengthen my muscle. So I started doing the weight training. Oh, that's extremely important. Okay. And the balance training is very important. Like you practice indoors, but you don't walk outside in uneven ground. So your balance doesn't get developed. Okay. So endurance and stamina, anaerobic, strength training, breathing exercise, balance training. So it should be a combination of all this when it comes to your physical activity and exercise. So that's extremely important. Okay. For your mental and emotional well-being, meditation is an excellent way of doing it. You learn to watch your own thoughts and emotion, okay, objectively, like a third person. Okay. And that's extremely helpful. Or you just spend time with your loved ones. You develop any hobby and something other than your profession. You cultivate this, or writing, or reading, or anything that you enjoy doing something that you can do hours and hours together. So that will help you to develop your mental and emotional well-being. Okay. Social, we are all good at, so that we need not tell. Financial also, we know how to take care of. Okay. Time management is very important. And the most important thing about time management is ability to say no. You just say no where you don't want to, not just because people are expecting, not just because you have responsibility all the time. You go on fulfilling other people's wishes and you just forget what really is that what you want. Okay, where you want to spend your time. I think that is the most important aspect of time management, is having the clarity and courage, say where I want to spend my time. So that is one resource which you cannot do anything to increase. Okay. And spiritual dimension is, there's a myth that people have that spirituality is only for the older people, only for people that they have, once they have fulfilled all their responsibilities. No, spirituality is all about developing the understanding and, attitudes in life. And that has to be cultivated very early. So just in my department, I conduct this meditation classes in my hospital, and all my students, they have to come. No, it's not compulsory for, it is compulsory for them. So they all attend. But there are my other colleagues, my junior colleagues, for them, I cannot make it compulsory. I can just tell them. So he never comes. Today morning, I was surprised. He sent one very nice message. It's about values of life, and and then he said, I'm so thankful to you that you've been teaching these values for many years. So even though he doesn't formally attend those sessions, but we do have our lunchtime discussions about all these philosophical aspects. And in that, he learned so much, even without, attending those sessions. And I was very pleasantly surprised to see that at very young age. I mean, he's 2 decades younger to me, but the environment that we have created in the hospital in our team, that she's learning, everybody's learning, and that is what is, I would say, a true happiness, where you are enjoying all aspects of life without, focusing and overdeveloping certain areas of life and disregarding other areas of life. So this is what I had to say about the key to holistic happiness, sustainable happiness. The sooner we realize and sooner we start acting on it, the happier we will be.
Thank you, madam. I think few questions have come. Just to start with it, as I was telling LVEF, one of our member told, he has explained in the chat box. It is, I think, related to your medical terminology. I think it is left ventricle ejection function. His question was
Ejection fraction. Okay.
yes,
Okay.
yes. So can a person improve their LVEF and by how much?
Okay. So yeah, ejection fraction, yes, it can be improved with exercises. Very much it is proven in the studies also. The only thing is that if you have some heart condition and low ejection fraction, we would advise that there are dedicated subject experts and there are dedicated departments, which is called cardiopulmonary rehabilitation department. So one should go and enroll in the rehabilitation program in this department, where you supervise to do the exercises according to your health condition. And over a period of time, we have seen many patients ejection fraction improve. And once they improve to a certain level, then they can do exercise on their own.
Another question has come, if IG level is too high, even after medication for 2 months, how to control and what is the reason for this high IG level?
So high IG levels mean that you have a lot of allergic cells in your body. They are allergic antibodies, okay? Now, just by having high allergy level does not mean that you have severe disease. It can go high because of skin allergy, because of allergic cold, because of asthma, or sometimes food allergies. Okay, and we need not do allergy levels frequently to monitor it, okay, because it doesn't reduce with your routine medication. But as long as your allergy symptoms are controlled, you need not worry about the high allergy levels, high IG levels.
Yes, madam, another question, how to improve the work-life balance? Like you have stated in your presentation, but still it's if you want to give some tips.
Yes. Okay. So I think that's a very important question, how to improve the work-life balance. So I think it's easier said than done. And I also have had my challenges to do it because, see, as you professionally grow, as you start doing better, there are more and more demands on your work and your expertise. And then it becomes sometimes very difficult to contain work. Okay. So the best way of improving work-life balance is, first of all, start giving importance to your life also. Okay. Like I see people, they come to me and then they said, oh, I used to exercise very well. फिर 1 month से बंद ही हो गया. Okay, I used to be very regular with my meditation. अभी 2 महीने से बंद ही हो गया. Now I ask them that, would you do the same thing with your work? If you have some important assignment or something, would you just stop working for 1 month? Can it happen ever? So no. How can you even think about it? Would you stop going to college? Would you stop going? So why do you stop doing exercise and meditation only? Because that is your lower priority. So something which is very important to you will not stop it. So make it very important that your life is equally important as your work. I see people being so dedicated to their work, their role, their responsibility, but not being so dedicated to their own life and their own health and fitness. So that one thing you should have very clear. Secondly, learn the ability to say no. Something which is not absolutely necessary, you can stop. You don't have to attend all the conferences. You don't have to go and deliver lectures everywhere. So you can say no and you can choose. Third is, I think, most important thing, creating teams and spending enough time to train your team. And that I think has worked the most for me, because I used to practice single, solo. Many of us practice solo. But when I developed the team and I gave enough time to pass on my knowledge and skill to my team, then I now am able to delegate them. They do a good work, sometimes even better work than me. And that has taken a lot of stress out of me, and I can, take time for myself. So I think delegating and developing a team is another key. So this is how you should find a work-life balance. Another thing, what happens, for very professionally driven people, that if they are not working, they are spending time for themselves with the family, or taking vacation, they start feeling guilty. That guilt feeling should absolutely not be there. Then you have worked so hard in your life to come up to this level, and now you deserve that time, spending that time, energy and money on yourself.
Thank you, madam. I think today's theme was dedicated to happiness. Unfortunately, India is having the fifth largest economy, but happiness index, as per the UN, we are 118th. So, what do you feel that how to improve our happiness score for the country?
Yes. So I think, first of all, before that, I think that all these indices you should not take very, very, seriously, because there are so many factors the way they are being conducted, so they may not be very accurate. But still, I think there are certain factors, I think, because we as country have been resource limited for a long time, and that mindset is still there. So we are, now compare, I mean, us talking about our socioeconomic class. So we don't have that resource limitation, but somehow that thing has gone into our mindset, is working hard. And workaholism is become so prominent that we are ready to compromise every other aspect of our life to be able to do work. So then multiple factors. Sometimes you feel insecure that if you don't do the work, somebody else might take over your position. Sometimes it may be because of need, and many times it's now become a habit. तो भी नीड भी नहीं है, इनसिक्योरिटी भी नहीं है, बट सालों साल यही किया है तो वो हैबिट हो गया है कि इफ यू आर नॉट डूइंग वर्क यू फील. So all these multiple aspects are there, which is causing our happiness index to go down. It is also to do with our systems. A lot of things, to get our thing done, we have to break our head so much. We don't, our day-to-day life is not as easy as in some other European or American countries. That is also one factor. But I think it's majorly to do with us, and we can change that reality. We can change that reality for ourselves from today only.
Yes, ma'am. Madam, recently we have seen our country's lifespan of all individuals have increased. Since last census or last even SDG report, we have seen our index improving because of lifespan. Do you think we are adding years to our life, but not life to our years?
Yes, that is true, because lifestyle increasing has many factors. People are able to buy more. They are able to spend more on their health. Health insurance coverage is much better. There's so much innovation in medical science, technology, newer drugs, and along with that, buying power. So people are living longer. I can see myself, the so many of my 50% of my patients who are hospitalized are above the age of 80, which used to not be there 10, 15 years back. They are affording more treatment, but not necessarily they're enjoying good quality of life. So that is what is important. And for us, when you're talking of sustainable happiness, it's not only we want to add the years to our life, but those years should be full of life. My father is 90 years old and he is so full of life. He's fit. He does his own marketing. He goes out and he's completely independent. And even today, he takes care of me more than I taking care of. And that is my ideal, This is how I want to be when I turn 90.
Great. Madam, I think today's session you have put us for food for thought that money cannot buy happiness. It can only be a part of our life. And I thank wholeheartedly, especially from our Sustainability Standards Board, our chairman, Dr. Ashish Thatte, and all our SSB board members, including Dr. Ranjit Krishnan sir, who has been instrumental in bridging with you and SSB. And we thank our other board members also for always encouraging us to organize more webinars. Especially, it's a need of the hour. We should have, as you have told, perfect balance of life. Without balance, nothing is possible. And as our theme is Vasudhaiva Kutumbakam, everywhere we should spread this happiness, making the world a better place to live. And I thank wholeheartedly, Madam, in spite of your busy schedule, you have taken the time off. And I apologize in spite of our best efforts. I think our this MS teams had certain issues. You had certain time loss due to means touching with us, but still something great happens. Some teething things always there is there.
Yes, it's always there. I think
Yes,
just one thing, if I'm able to inspire today, is that start taking yourself, your life, and your happiness on a priority basis. Just that shift of thought also happens. I think it's a big deal. And then all of you would have different life situation, different health condition. You will find your own ways and you'll find your own help, for achieving that goal. But if that shift in the thought or attitude happens, I mean, I would be very happy if this session has been able to achieve that goal.
definitely, madam. We had our insight. We had a great takeaways. Like we always think that short-term benefits are most important, but you have given us the thought that we should invest on in our health, which is the most important investment, rather than any mutual fund or any stock. I think I thank Madam wholeheartedly. And today being now the uh, situation is also not good. I think this sentiment is always there because the scenario, the sentiment and other things, environment is not so conducive. But still, we should make the best efforts to make it convenient. Thank you, madam. And I think you have spared time to us, and we hope in future also you will come and you will inspire us, motivate us to organize more such events in the coming days. Thank you, madam. With this, we close today's session. Thank you all and hope to see you in our next webinar.
Thank you.
Yeah.
Thank you, all of you.
Thank you, ma'am.